West Virginia has been called the epicenter of the opioid crisis, with the highest number of drug overdose deaths in 2017, according to the CDC. But many across the Mountain State are working to change that. 13 News reporter Lily Bradley joins us now live with more on that story. Lily.
Jennifer, according to the State Department of Health and Human Resources, the number of opioid deaths last year dropped nearly 6%, but it's still a struggle that has impacted many families. And now one Charleston mother is working towards turning her loss into a lesson for others. Denise Hansen is no stranger to the destruction of opioids. As a nurse, she's treated many patients struggling. But the crisis is also one that hits, tragically, closer to home.
I want people to learn what I've been able to learn since Greg's death, so that they can help their children.
Hansen's son, Greg, died from an overdose in 2016. He was 26 years old.
We now know so much that I wish I would have known then. And if I can help another parent, if I can help a healthcare worker, a nurse, a social worker, a recovery coach, if I can help, that's what I want to do.
Denise is one of the organizers of a conference happening here this weekend at the University of Charleston. The goal? To bridge the gap between those in recovery and the professionals who treat them. The first ever Building a Healthy West Virginia conference will include a number of different discussions, from the latest advances in the science of addiction and treatment to successful treatment alternatives.
To change the state from being a state of the epidemic of death to the epidemic of recovery.
Those who attend the conference can get continuing education credits, not just for nursing, but for other health professions as well.
We are going to be able to give them tools that they need to be better patient advocates, to treat patients more effectively when they see a patient come into the hospital, or whether it be a doctor's office, and they see that, you know, hey, this patient needs help. Normally, I don't know how to help them. I don't know who to refer them to. I don't understand this disease. Then they'll walk out of there knowing.
Wow. So that is such an important topic, though.
Absolutely.
How can people get involved?
So that conference is tomorrow, Saturday, from 8 to 5. If you'd like to learn more about West Virginia WVROCS and the other groups that are a part of this conference, we've got that information available for you right now on our website.
And I know you're going to be there all day tomorrow as well.
We'll be there all day tomorrow as well.
We look forward to seeing you there. Thanks so much, Lily.